Welcome to the Tarrant County Medical Minute podcast.
Welcome, everybody, and happy 4th of July week. My name is Brian Swift. I'm the CEO, and we want to welcome you to the Tarrant County Medical Minute. I am happy to be joined by Dr. Kenton Murthy, who is Assistant Public Health Director and the Local Health Authority Director. And Dr. Murthy, we've been here before. Welcome.
Thank you.
And so why don't we talk about, when you say Assistant Medical Director, and you also say the Local Health Authority, what are the two differences of those entities that you oversee?
Absolutely. Well, thanks for having me back. It's great to be back. So as Assistant Medical Director, I help oversee our clinics. So our nursing staff, our clinical staff help drive direction for how the clinic should perform, along with our medical director, Dr. Colquitt. And so we kind of set standard operating procedures, delegating orders so our nurses can follow for vaccinations, for STDs. And so we kind of set the tone. That's more of an internal kind of title. The Deputy Local Health Authority is actually a state function, and it's in the Chapter 121 of the State Health and Safety Code. And that puts me as a state officer during times of outbreaks or epidemics. So if there were an outbreak, or for example, historically it's always been tuberculosis, if there is a disease or infectious disease of public health concern, as a Deputy Local Health Authority, there are certain powers that reside that I could help quarantine an individual if I feel that infectious disease is a public health concern.
Got it.
And so it's historically, again, it's been used for tuberculosis. We don't use it very often here in Tarrant County, especially with tuberculosis, but it is a state power that's granted to us.
Got it. So we had talked about the purpose was back a few weeks ago, we had measles outbreaks that were going on. So we wanted to focus this podcast on measles and vaccinations. And so why don't you talk a little bit about what was going on a few weeks ago with measles? And now right around the corner, we're going to have school startups. So how do measles and immunizations, how does that all coordinated through what you guys are doing at Public Health?
Yeah, so I'll give a current background where we're at. So as of June 26th, we have roughly 1,200 cases of measles in the United States, of which 744 are here in Texas. And the good news is it seems like the measles rate is on the decline. So it seems to be burning itself out. It all started in West Texas. Most of the cases in Texas are related, and some of the adjoining states like New Mexico and Oklahoma are related to that West Texas outbreak, and a handful aren't. But like I said, the good news is it seems to be burning itself out, and it's going on the decline. So that's the great news. Here in Tarrant County, we've had 4 known cases of measles, concentrated in a family. The great news is because Tarrant County has such great vaccine rates for measles, it didn't spread beyond the core family. So it stayed there. We didn't have it spread, and so now we're just continuing to monitor. So that's great news.
And we did a lot of PR, all of us, right? We really got the word out,
Absolutely.
I think, mobilized before this got any worse, because we were definitely worried, right, back a few weeks ago.
Yeah,
so
with your guys' help, with medical side's help, it was fantastic. Got the message out.
Nipped it in the bud.
You got it.
So getting back to the schools and getting back to immunizations, we had a lot of parents out there that are wondering, okay, got to get my kid. They're not going to be able to go to school, right, if they don't get immunizations. So what do you tell a parent that says, oh, my God, I don't know what my I don't know. I forgot. My records were lost. You guys can help with that, right?
Absolutely. So we have access to the state immunization record base, which is called MTRAC. And so if your child and if the parent signed up for the vaccine records to be put to the online state database, our nurses at our immunization clinics have access to it. And so if you don't know, if a parent doesn't know if they got their child vaccinated, they can come to any one of our immunization clinics. We could look up the record for them and find out if they were vaccinated. If they're not vaccinated, we can give you the MMR vaccine right then and there for your child, provided they're within the age group, the appropriate age group, and we could do that. And if they have their records, great. We can give them their second shot, or if they're up to date, we're good to go.
So that really takes the anxiety out of, right, oh my God, I want to make sure that I don't give them too much of something.
Exactly.
And you have access to looking it up and take all their anxiety away. So the message is get your kids vaccinated because school's right around the corner. Better do it early than when the rush comes in, right? We don't want to have the kids miss any school days.
Exactly.
So you guys are all ready to go.
Exactly.
Ramped up.
So parents don't know, just have them walk to any of our immunization clinics. We have five brick and mortar clinics in the county. They can walk to any one of them, and we can absolutely look it up. And the great news is if you're behind on vaccines or you need to get ready for your kids to get their school appropriate age vaccines for the fall. We have our shot rush, our annual shot rush. We've, in conjunction with the Immunization Coalition of Tarrant County, have been doing this for over 30 years in the county, where we have a 3-week shot rush push and back to school vaccination push. And so we will be out in the community. We have 3 locations. It starts July 26th. Runs for 3 weeks. Every week is a different location. It's on our website. You can look up where we're going to be. All you got to do is bring your records, and if you don't have them, we can help you with them. And you can get your kids vaccinated and up to speed. This year, we're doing something a little different. Along with ICTC, our Immunization Coalition, Tarrant County, we're working with Cook Children's to really get our vaccination rates up. We're trying to get 10,000 kids vaccinated, which would be a record for us. We have done before last year, it was around 8,000. And so this time we're shooting for 10,000. And I think we could do it this year.
And I know our Tarrant County Medical Alliance is very involved, leading the charge, right, on immunizations. They're very passionate about that.
Absolutely.
We're passionate about it. So... So kids, we're always worried about kids.
Always.
First of the year, school year. Talked about that. What about adults? That, you know what? I don't know. Here again, I don't know if I had this. I don't know if I had a tetanus shot. The list goes on and on.
Correct.
What about adults? Can they do the same thing and come to health department and find out?
Absolutely. So now, M-Track was a more recent kind of invention. So if you were a kid in the 90s, and we might have your records, but if you were older, we may not. So always recommend check your records, talk to your doctor if they're around, and see if you can get your records. If not, here's some options we have. So if you were born before 1957, measles was considered endemic in the United States. So there's a very high probability if you didn't have measles, you were exposed and you had the antibodies.
Got it.
So a quick and easy check could be to go to your doctor and ask to have your titers checked for measles. We also do them at the health department in our immunization clinics. We can check your titers. And if you are positive, great. You're immune either through natural immunity or you have the vaccine and you're good to go. If you were a child born before 1969, somewhere in that area, you got vaccinated, maybe it's on your record, you most likely got an older version of the measles vaccine. In that case, it's recommended that you get the newer MMR vaccine, the 2-dose series. And again, we can take care of you at the immunization clinic. And then if you don't have any records of your vaccination status as an adult, again, 2 things you could do. You could check your titers, see if you were exposed or had vaccine, or you can go ahead and get your MMR vaccine if you have no documented evidence. It's safe, it's effective, it works. And just as a personal note, I was born in 79. At that time, the CDC only recommended 1 dose of the newer MMR vaccine. And in the 80s, we had a big outbreak. And so then the change came over to a 2-dose series of the MMR. Well, I looked at my records, I only had 1 dose. And so I just got my second dose, about 3 or 4 months ago.
Oh, there you go.
Yeah, so it was fine. I didn't even feel. The worst part was the bandage that was stuck to my skin, ripping that off. But otherwise, it was great, easy peasy. So highly recommend just getting it done.
So on the immunization kind of history of that, how do diseases like measles resurface?
Oh, yeah.
When you're immunized, how does all that work?
Great question. So last time I was here, I gave a little public health history. I love medical history.
Right.
And so I think to answer that question, is kind of like how vaccines work, effectiveness rates, I think we got to take it back and really look at the history of vaccines. This idea of vaccines seems like a relatively new concept, but it's been around for eons, for centuries.
Okay.
It all started with smallpox. So we take you back to the early 20th century. Smallpox was just a disease that was rampaging throughout all of the world. It caused those pox, it caused pneumonia, death, it was killing children and adults. In fact, it was estimated that in the 20th century, it killed roughly 400 million people. So it's killing millions of people a year. This idea of smallpox, there's kind of two variations, variola major, variola minor. Variola major was the one that killed about a 30%, 40% mortality rate.
Wow.
And the minor one didn't kill as many people. So I'm talking about way back in the early 20th century, early on, in China, in Asia, they were in the Middle East, they were doing things where they would take pustules from a mild case of smallpox and put it to someone who didn't have smallpox, and that person wouldn't develop a really severe disease and they wouldn't die. We call that variolation, the idea that you took a disease from someone else and gave it to someone who didn't have a disease. That started this concept of vaccines. So then fast forward to 1790, a young physician by the name of Edward Jenner. He was a general practitioner at the time. He was in England, and he had noticed that, and smallpox was rampant in that community, and he had noticed, though, when he was there, that milkmaids who would milk cows were getting these small pustules on their hands, similar to what was on the udder of a cow. And he asked those milkmaids, and he said, have you ever had smallpox? Do you have smallpox? And they said, no, none of us have ever had smallpox. And this is, mind you, this is 1700. So there was no idea of viruses, bacteria,
Sure.
The germ theory didn't exist. But he had speculated that, there must be something going on in this pustules of the milkmaid's hand that doesn't convert it into smallpox, that they don't get the disease. So he tried an experiment. He took pustules from a milkmaid that had the cowpox, and he transferred it to a young boy, and then later on introduced that young boy to smallpox, things that we couldn't do now. And that child did not get smallpox.
Wow.
And so that was the very first development of a vaccine. And that's where vaccine comes from. Vacca is Latin for cow. And so that transfer from cowpox to prevent smallpox was the first vaccine that was created. That spread throughout Europe and spread throughout the Western world. And so that was the first introduction to reducing the smallpox disease. And then the World Health Organization in the 1970s eradicated smallpox completely with the newer vaccine by basically vaccinating the outbreaks and the people around those outbreaks, and we completely eradicated smallpox because of vaccine back in the 1970s. And so it's a remarkable we look back at that history, how important vaccines are for preventing disease.
Right.
And that's the thing that we have to understand. While these are all therapeutics, we have vaccines that prevent disease, and then we have treatments that treat a disease, like antibiotics or antivirals. They treat a disease. So when you look at prevention, the idea of prevention or vaccines are all to gear the immune system and prep the immune system so that it is ready to fight the actual virus that it may see. But all vaccines, just like therapeutics, have very different effectiveness rates. It just so happens because measles, the virus, the only known host of measles is the human and not in any other animal. It doesn't mutate or change as quickly as other viruses such as flu, which can go from birds to humans to animals to humans. And so because of that, this measles vaccine works really well. It's about 97% effective because humans are the only known host of the measles virus.
So the bottom line, this is always developing.
Yes.
And as technology goes along, as science, we gain more knowledge.
Correct.
We just come up with better ways to eradicate things.
Yeah, and that's why I think the history of vaccines is so important. It's been around for centuries. This is, again, not a new concept. We've been doing this forever. And again, something like a disease like a smallpox that was killing kids, moms were just didn't want that to happen. So they went to the doctor like Edward Jenner, and he introduced this concept, and this is what did it. So yeah, vaccines are an old prevention, and it's one of the most powerful things we have.
All right, here's the dumbest question of the day. The dumbest.
Never any dumb questions.
Smallpox.
Yes.
Chickenpox.
Yeah.
I remember I had I think it's still there.
Yeah.
If you look.
Yeah, I have one
circle.
too. I had chickenpox as well.
Those are two different, right?
Yep.
Because smallpox was
Yeah.
the bad one.
Bad one.
Bad,
yes.
bad.
Yeah, different families, but
Yeah.
different genuses, but they produce similar symptoms.
Got it.
But yes, smallpox was, and so now it's eradicated. So it's it's not there's no growing in here. Only certain labs have it, but chickenpox is far less deadly than smallpox. Yes, completely different.
That's a good thing.
Yeah.
That's a good
That's a very
thing.
good
See, this is why I love having you on.
Yeah.
And I know people love watching this podcast when you come on it because you give all this history. I mean, it's important, right, to
Absolutely.
learn. And because it's so easy these days to be skeptical, right, of things.
Yeah.
And so when you go back and at least you have some history,
Yeah.
I think it's good.
I mean, think about it. I mean, even say the measles vaccine, which started in the 60s, the more modern one came out in the 70s. What is that? 40 years, 50 years that we really hadn't seen measles because everyone's keeping up with their measles vaccine. Some of these things we just almost automatic, maybe take for granted that we're like, oh yeah, we're not seeing diseases because we've eradicated them with vaccines. Okay. And so when unfortunately the vaccine rate decreases, we're going to see outbreaks. And to answer your point about we're seeing measles again, yeah, that's unfortunate just because we've had this kind of decrease in the trust of vaccines, probably ever since COVID, and we're working hard to rebuild that trust. Now, that being said, especially in Tarrant County, the vast majority of Tarrant County residents support vaccines. They're pro-vaccines. They understand it. They think it's important. That's why they come to Shot Rush. That's why they come to our immunization clinics. That's why we haven't had community spread of measles here in Tarrant County, knock on wood, because our vaccine rates overall are very good, especially for measles. Now, do we have pockets? Certainly. Where we have low rates, but overall it's really good because we have a very supportive community that they understand the importance of vaccines.
All right. So I've got a couple more questions. We're going to wrap this up, but why don't you tell me a little bit about what cool things are going on right now at Public Health? Right? I mean, we have new leadership. Certainly you're part of that leadership. Yeah. And so kind of what's going on over at Public Health? What are some things the public can expect to see over the course of the next year? Well,
we're all changing kind of this new reality of where we're at with federal government and changes there, and we're all adjusting really well. The great news is, we have a very strong support from our county for public health. We have a new public health director, Dr. Brian Bird. He's a family doctor, been in this community, he grew up in this community, he's been around for a long, long time. He's really given us a new direction, new focus on how to achieve with always a limited resources, how do we do more? And that's what we've been working and striving hard to. So whether it's expanding immunization clinics, expanding our TB program, working on our HIV and STD rates. So really coming with new and innovative ideas to do that. We're preparing for 2026 World Cup. That's the big one that's coming up next year. So we're going to have people from all different countries coming here in Tarrant County. They're going to start coming, I think, in March of next year. So we are preparing for that because they're going to bring with them any other, maybe infectious disease, other things that are coming in that they're bringing in. So we just have to be prepared and make sure that if, God forbid, an outbreak of something happens, that we're ready to go. So we've been preparing for the World Cup and working with our community partners, such as the Medical Society, Arlington Fire, all the Office of Emergency Management in Tarrant County and otherwise. They're having monthly meetings, just getting ready for a big event that's coming up. We're excited about it. Can't wait for it, especially if you guys are all soccer fans and looking forward to it.
Yeah. So. I'm waiting for football season. I'm waiting for the Packers to start playing.
There you go.
So,
Me too. Yes, I'm a football fan. Yes.
All right. Well, why don't we wrap this up? And I think you kind of gave probably an answer. I always like to ask people in positions like yours, what are the things that kind of keep you up at night? I'm sure a World Soccer event might keep you up at night, right? When you guys are laying out plans like mass casualty, those things have got to be always in the back of your mind, preparing. If we get the call here, how are we all going to rally together? And I think what's really important is we do have a community that I think really works well together on these events. You know, we just had Dr. Jeff Jarvis and we talked about, okay, the changes now going on with MedStar, how we're switching over.
Absolutely.
But there's a lot of really great coordination, especially when it comes to physicians and all the health people that support doctors, nurses, you name it. I think we've got great coordination.
Yeah, I agree. And it's getting better. You know, I hate bringing up COVID all the time, but COVID taught us how to work together. I think that, I mean, we can't get around that. I mean, if there's any silver lining from COVID, it's that we learned how to work with all the health partners learned to work together. So we're continuing that relationship with medical side. Actually, our relationship has gotten stronger since COVID. We've been meeting with all our hospital partners. In fact, we're on our 2025 hospital tour, meeting with all the major leaders of all the hospital systems and coordinating with them. Work with the medical schools here in Tarrant County. So it's been real fascinating, and that part of community, especially the health community, banding together, because we know we can't do this alone.
Right. We
need all the help that we can get, and we have to rely on each other. I think that's really a testament to our strength here in Tarrant County, and so I think it's been interesting and amazing to watch these changes over the last. I've been now at the health department for 7 years and seeing how things have evolved and changed. And I think it's going to get stronger as we move forward. I'm really optimistic about the future. And I think it's going to be nothing but us banding together to work together to help our community. That's all we want to do at the end.
Right. And being one of our leaders here at the Medical Society, you know, we have the 2 student events. We got the new classes that are going to be coming on.
Oh, yeah.
And what maybe a lot of people don't know is Dr. Murthy is a UNT grad.
That's right.
So we've got our own, local.
That's right.
And so when these students come up, and I love watching them interact with our docs, especially you. So when our students are coming in here in a couple weeks, and they come up to you and go, hey, why don't, I'm thinking about public health, right?
Yeah.
What would you tell a student that is thinking about a career in public health?
Oh, I think it's great. Public health, so for me, family medicine, primary care, and public health go hand in hand. It's family medicine doctors and primary care doctors are on the front line of health, and with public health, it's the same thing. You're on the front line of health for the community. It's just now your patients are, instead of say 3,000 patients in your charge, now you have the entire 2.2 million people in your county or wherever your county is.
Right.
So they are my patients. I always look at Tarrant County residents, they are my patients, and my goal is to give them the best health information for them to make the best choices for them. And I think that's why, as for young medical students that are interested in a career in public health, I think it's exciting because you have a large patient base, and your goal is to be compassionate and empathize and help, especially those who can't help themselves or have the inability to have access to health care. That's our goal. Our goal is to help them and make them better and improve their quality of life. And so public health is a great career choice, and I can't wait to talk to these students and be like Omar and get most of them in public health instead of PMR.
Exactly.
And try to get them all into public health. So it's exciting time. Yeah.
All right, my friend. Well, again, always love having you, coming on the podcast, and love your leadership, and thank you for being a sounding board for me, because we always talk about stuff.
Absolutely.
And I just want to say, make sure our audience check out our links and have a great 4th of July weekend.
Thank you so much.